What are the assessments that you need to make in a patient who presents with a breast lump? This is the favorite question, many times asked in the AIIMS staff nurse recruitment exam. You have to be very sure how to evaluate a lady who is having the breast lump. So what do you want to do? So you need to do the examination of the breast in the supine position, examination of the axillary lymph nodes inside the axilla, the lymph nodes ko evaluate karna hai, and you need to do the fine needle aspiration. The fine needle aspiration. They're all the investigations which are being done. Now let us see, as a nurse tomorrow, what are you going to do when you have a lady who came with a lump in the breast? How are you going to evaluate? This is the most important algorithm. Algorithm means what is the procedure to evaluate. So आप ध्यान से review करो. Bilateral breast examination करना है supine position में बिठा के. Supine का मतलब क्या है? If you make somebody lie down with the head looking towards roof, इसको बोलते हैं supine. आप soup कैसे पीते? Soup ऐसे पीते, right? Soup. Supine with the head looking up. Whereas if you happen to sleep with your head looking down to the bed, that is called prone position. So supine position में examine करो. Now there is no palpable mass. You are unable to palpate. Palpate means feel. You are not able to feel any mass. Then look, what is the age? Age is less than 35 or age is more than 35. That is very important. Agar age is less than 35, that is commonly called premenopausal age. Premenopausal age. है तो क्या करना? You need to tell her that you can recheck, you can come for a recheck of exam 1 month later. Because finding palpable masses in the breast is not uncommon in the age less than 35. When a woman is having regular menstruation, then there are hormonal changes that keep happening and that can bring few masses which will disappear. So 1 month ke baad. Now the patient once more came back and she said that no, it got resolved. Then you need not worry. Only thing is you can ask her to go for a screening mammogram. Screening mammogram. Suppose if it is unresolved, if the problem is 1 month ke baad if there is a lump in the breast, what do you want to do? You need to refer to the surgery and you need to ask her to meet the surgeon. That is very important. Suppose if the age is more than 35, then don't ask her to go home and come after 1 month. You have to do a diagnostic mammography. Mammogram के लिए order करना पड़ेगा. Suppose if the patient says, भाई मैं 3 महीने के पहले भी यही प्रॉब्लम आया, मैं गया और वहाँ मैमोग्राम किया, मैमोग्राम में कुछ भी नहीं निकला, there is nothing in the mammogram, then what do you want to do? So fundamentally you will look whether it is normal or abnormal. So suppose if it is done within the last 6 months, there is no need for doing mammogram. Suppose if the mammogram done in the recent 6 months, if it is normal, then you can ask her to go home and come for a rechecking after 1 month. Suppose if it is abnormal, then you need to refer to a surgeon. So that is the story. If on clinical examination there is no breast lump that you are able to palpate. Suppose if you are able to palpate, तो क्या करना है? एक palpable breast mass दिख रहा है आपको. Then what do you want to do? You need to do the aspiration. Aspiration, typically in a primary care setting. Then वो aspirate करे तो क्या निकला? Suppose if it is cystic, that is containing fluid, then after you aspirate, lot of times the breast lump which is felt become invisible. So if it become invisible, ask her to go home and come for a recheck after 1 month. And if there is no recurrent mass, then look her age. If the age is less than 40, then you need to send for screening mammogram, depending upon her other risk factors. There are some risk factors to get breast carcinoma. Now, if the age is more than 40, then you need to ask her to go for the screening mammogram. So that is the plan if it is a cystic fluid. अगर lump है, palpable है, आप aspirate किया, अगर किए तो cyst में fluid निकला, अगर निकले तो residual mass चले गए तो then you need to go for rechecking. So don't forget this plan. Suppose if there is a residual mass, even after you have drawn the fluid, if there is a residual mass left over, if there is some mass which is left over, then you need to do the diagnostic mammography in her is an important principle. Suppose when you are trying to do the aspiration, कुछ भी fluid नहीं आ रहा है. It is a solid mass. It is not a cystic palpable mass. Palpable mass है, मगर cystic नहीं है, solid है. Then what do you want to do? Suppose if the age is less than 35, then you need to refer her for a surgeon's opinion. If the age is more than 35, then you need to ask her to go for a mammogram and you need to refer to the surgeon. So this is the protocol whenever there is a breast lump. So AIIMS exam, staff nurse recruitment exam ka favorite question. Examiner is expecting, do you know how to evaluate a breast lump? So you are now very confident, right? So don't worry, this PowerPoint, all these slides, everything is available in the nursenoukri.com video library, right? After this session is over, we will upload this video and this PowerPoint also. So you can be able to do the revision very well. All 8,000 MCQs that we are going to discuss, you are going to do the revision. So tension nahi hai. Aram se padho, aram se samajh lo. That is very important. Understand the concepts. You will become the topper, sure shot topper. So breast cyst jo hota hai, how will you identify a breast cyst? It is smooth, it is unilateral, it feels like a cyst. Only infrequently, matlab rarely, it is associated with malignancy. And you can aspirate, and when you aspirate a good number of times, the cyst become impalpable is what you have to basically remember. So once more, tell me, Roja, pre-menopausal, post-menopausal, that's how you look at it. Pre-menopausal, menopause nahi hua, young hai, dominant mass hai, questionable mass hai. Questionable mass doubtful hai, मगर वो डर गए क्योंकि टीवी में देखा ब्रेस्ट कैंसर बहुत ज़्यादा हो रहा है बोल के. So re-examine after 3 to 10 day cycle, mass is still present, then you need to basically do the aspiration. If it is cyst, already you know what to do. If it is a solid mass, then you have to do mammography and refer to a surgeon for a excisional biopsy. What is the meaning of excisional biopsy? Excision का मतलब काटना. To cut is called excision biopsy. So there is something called TruCut. TruCut is like, there are two terms you should understand, sister. One is aspiration, other is TruCut. Aspiration hota hai, put the needle and then you are drawing, that is called aspiration. Whereas TruCut is like you are taking a small piece out when you are doing the excision, and then you will examine under the microscope. That is called TruCut biopsy. Need to be ordered. So that is what you should basically plan. So once more, if there is a palpable mass, if you have aspirated, if the fluid came out, then that is a cystic one. Now the question comes. Fluid ke color se kuch pata chalega kya aapko? You know what to do. Suppose if you aspirated a palpable mass and you found bloody fluid, then what do you want to do? You have to do a surgical biopsy, because blood, when there is a palpable mass, if you happen to aspirate, agar blood nikala to, then you have to be careful. You need to be very sure to rule out the possibility of the breast cancer. So that's the reason surgical biopsy ke liye order karna padta. Suppose if it is a non-bloody fluid, non-blood nahi nikla, then, but still there is some residual mass left in spite of taking out the fluid, then that is also an indication for surgical biopsy. Please remember. Suppose if the cyst is resolved after you have drawn, it is non-bloody fluid, then you need to re-examine in 4 to 6 weeks. So if there is no recurrence, then you need to do follow-up. And suppose if there is a recurrence, once more after 6 weeks, if there is a recurrence, then what do you want to do? If there is repeat aspiration you need to do, and you need to consider the biopsy. Now Roja is asking a question, mammogram plan only for post-menopausal ladies only, na sir? Very good question. See, what do you like me to call you, Roja? Roja should be called as Roja, right? Yeah, that's good. So remember, because last 20 years, thousands of doctors for their postgraduate medical entrance, I have given coaching even today. So I got habituated to address people as doctor. So, but anyway, I'll say Roja. Roja is our representative sister, right? So now the question comes. When you do the mammogram, typically if the breast is very thick, fatty breast, then it is very difficult to assess using the mammogram. Mammogram ko interpret karna difficult ho jata. That is the reason generally premenopausal women, their breasts are very thick. So that is the reason the mammogram is a preferable one after 40 and difficult to interpret before 40. Difficult to interpret before 40. Difficult to interpret. That is what you should basically remember. You understood, Roja? Good. That's good. So that is the great advantage. If it is a live class, hundreds of students are sitting, it's very difficult to ask question to the teacher. Whereas online you can chat, you can ask questions, you can do anything, right? Yeah. So tomorrow Roja is going to bring another 100 students in her classmates, right? Now, let's look at the breast pain. Sometimes patients come with breast pain in the breast. How are you going to evaluate the patients who presented with breast pain? Once more, you should look premenopausal or whether postmenopausal. Postmenopausal hai to mammogram karo, mammogram normal hai to reassure karo or घर भी जाओ. That is very important, right? Now, suppose if the pain is persisting, then you need to document how severe is the pain. There is something called visual analog scale. Visual analog scale. Matlab, you will take 0, 1, 2, 3, 4, up to 9 you call. You will ask, kitna pain hai? In the 0 to 9, what is the level of your pain? Suppose if the patient says, oh, my pain is about 8 level, doctor. Then the pain is more severe. No. Kali 4 आना है, 8 आना, 12 आना भी नहीं है, kali 4 आना pain है. Then that is called milder pain. इसको बोलते हैं visual analog scale. Then lot of times the breast pain is because of a condition called AND. AND का मतलब क्या होता है? A for abnormal, right? Abnormal. A means 1 minute. So A means aberrations, not abnormal, aberrations. Aberration का मतलब होता है something which is suppose if somebody is having a very long nose, Everybody has some size of nose, some little more longer nose if somebody is having. That's called aberration, right? So other than little away from the normal look is called aberrations of normal development and involution. अच्छा, इसको AND कहते हैं. See, the breast is a tissue which continuously keep developing throughout the menstrual cycle. So it is like a factory. When estrogen is more, the development is higher, right? So when this development is normally happening high, and also it will be involuting. Involuting means it will be once more reducing, once more increasing. That's how the growth inside the breast will be. So if there are any aberrations in this normal development and growth and involution, इसको कहते हैं AND. AND जो होता है, it will present with pain in the breast. So, but it is very benign. There is nothing to worry. It won't lead to any cancer. For such people, to provide the relief to the pain, primrose oil is a very good choice that you need to basically remember. And suppose if the pain is not relieving, it is very severe, then the choice is to give danazole. Danazole is a medicine that you need to remember. DANAZOL. Danazole is the one which is basically preferred. So that is how you approach the breast pain, the breast mass, what to do in a case when a woman presents with breast pain or breast mass.